Please, we would like to start. Zaki?
השלישית והלאה? כן. כן. You will need it later for some speeches in Hebrew, yes. Ambassador Chanev, Magen David Adom Director General, Mr. Eli Bin. Dear guests, good afternoon. Thank you for being with us to this important event where we will be officially launching SynSafer concept, which was developed by the No Fear project, which is a European-funded project under Horizon, the Horizon program. We have a very distinguished list of guests representing the European delegation to the State of Israel, the Israeli Innovation Authority, the Ministry of Foreign Affairs, Ambassador of Chile, representatives from Spain, Malta, and the ICRC. Again, thank you for being with us today. Units 142, 1503, 1783 respond to a car accident with multiple pedestrians injured. Be advised to follow safety protocols. Each and every EMT and paramedic in the world hears that sentence many times a day, a week, hopefully never, but this is our reality. And then, if we want to be honest, we should ask, what are the safety protocols to be followed? From day one in our training, we are trained that safety comes first. It's a very basic concept with a very clear idea. If myself, as a responder on the scene, never mind if I'm a police officer, a firefighter, or an ambulance person, if I'm injured, I become part of the problem. I'm no longer part of the solution. So I should first look into my safety and the safety of my team. And to be honest, in most of our calls, it is rather easy. If I have domestic violence and a patrol car arrives to the scene, the police officers will apprehend the aggressor, secure the scene, and it's okay. I'm clear to go. The problem is security-related incidents. And we have here an image from that horrible attack in Las Ramblas in Barcelona. Las Ramblas, a very simple incident. 1.3 kilometer length of the street. The perpetrator ran away. He was no longer on the scene, so nobody knew his whereabouts, if he is armed or not, what are the intentions of the perpetrator. and I'm sure everyone, almost everyone in this room, have been to Las Ramblas in Barcelona, and you know that it is full of small streets, 4-story buildings all over the place. It is impossible to secure such a scene. At the same time, we have injured people on the scene that need to be treated. They are treated by their fellow citizens. We need to remember that the citizen is the true first responder. They are first. We are the second. So we need to treat them. And the first thing that we came out with as a project is the idea that in a security-related incident, the scene is never 100% safe. We are going to work in scenes that, to a degree, sometimes to a great degree, are not secured. And we need to provide our EMTs, paramedics, staff, and volunteers with a concept that will allow them to be safer on the scene. This is the Scene Safer concept. And here comes the No Fear Project. No Fear Project is a project under the Horizon Framework Program of the European Union, where we created a network of, a network of academia, industry, and responders who worked together for 5 years to discuss issues at stake, to bring closer the academia, the industry, and the users, and to identify our needs. You can see here the remarkable network that we had, starting with our colleagues in Italy, Yupo Crimedim in Italy, which were the coordinator of this project, our beloved friends from SAMUR Madrid, who are close friends that we exchange, I would say, on a weekly basis, information with them. And we came out with the Scene Safer concept. The Scene Safer concept is a mnemonic, a way to allow our EMTs and paramedics on the scene to think. And we start by telling them, stop. Stop and assess the scene. Understand what is going on. Look into the context. The context is important. Israel is living through times of demonstrations. And I will give you 3 examples of the last week. We had demonstrations over the runover of a small child, which became violent. We had a riot, a real riot, last Saturday. And every weekend over the last 30-something weeks, we have demonstrations which are peaceful. Same situation, demonstration, very different scene. So context is essential. We need to look into the emergency services which are on the scene and understand what they think. Because you can look at the same scene, a police officer understands one thing, a firefighter understands another thing, and an ambulance person understands a totally different thing. So the combined thinking of all of us brings together a good understanding of scene safety. And this is what our colleagues from Ireland, from Norway, from Spain, and from Magen David Adom came together because we all have this unfortunate experience of dealing with terrorist attacks. We need, of course, numbers are key, and we need to think about our entry and exit into the scene. And then we need to take action. And when we say, how secure is the scene, the idea is very simple. We are talking about a scene. It's not true. Different areas in the same scene have different threats. Sometimes just turning around the corner will make the situation totally different when it comes to your safety. We have to take action. Magen David Adom personnel has flak jackets and helmets in our ambulances. Just last Saturday, our Director General gave the order that all the staff members dealing with the riot will use their helmet and their flak jackets to protect them because there were objects flying all over the place that might injure them. This is part of your actions. Now, you need to look into what happened, but you need to think about what is going to happen. What is the evolution of the scene? And is it being controlled or is it getting out of control? And then, of course, you need to report back to your operations room where the bigger picture is being created and reassess the situation as it changes constantly. In your bags, you will find this, a keychain holder that as of tomorrow will be part of, this will be the official key holder for all the ambulances in Magen David Adom to remind our staff and volunteers about their safety every time they go into the ambulance. It's being adopted by Magen David Adom as part of our training program for staff and volunteers in an online module, and everyone who will finish their online training will receive one of those to remember that. And we are already talking, and I was asked why Chile is here, because Chile is facing, unfortunately, many similar challenges when it comes to urban violence. And we are already talking with them about the adoption of this concept by the ambulance services in Chile, as well as with other countries in Europe that will look into training and using this methodology as a way of thinking. Samur Madrid, of course, they are part of the story. So, just to show you again, our friends and colleagues from France, Ireland, Belgium, Spain, Austria, UK, France, I said, the Netherlands, and Germany, who were part of this project. And I would like to invite Ambassador Chanev to give his word.
קודם כל, תודה רבה שהזמנתם אותי להיות פה באירוע הזה, שחשובה מאוד בשבילנו כולם, ושהיא חלק מהשיתוף פעולה המצליח שיש בין האיחוד האירופי ובין מדינת ישראל. ברוכים הבאים לכולם. The Director General of Magen David Adom, dear Disaster Management and EU Projects Coordinator Chaim Rafalovsky, dear Ofir Karif and Asaf Moran, Directors from the Foreign Ministry, dear Dan Seker, Senior Director for Digital Industry, Space, Security and Society, the Innovation Authority, ambassadors, diplomats, distinguished members of Magen David Adom, ladies and gentlemen, and colleagues from the EU delegation, of course. It's an honor for me to stand before you today on behalf of the EU delegation in Israel. Firstly, I would like to extend my heartfelt congratulations to Magen David Adom for the initiative. It shows clearly the key role that research can play in the development of innovative, life-saving medical measures and tools. And I'm also proud to mention that the Scene Safer Memory Aid was developed under the framework of the No Fear project that has been mentioned, and the Emergency Medical Care Cluster funded under Horizon 2020, the previous EU research framework program. The world has gone in the last few years through the COVID-19 crisis, which taught us all the importance of swift coordination across countries and stakeholders to tackle global threats, health challenges, and public health emergencies. And furthermore, in recent years, the rising frequencies of other type of cross-border crises, including climate change, terrorism, and other disputes, riots, also require large-scale planning for preparedness in order to allow the countries to be able to cope with unforeseen challenges. So looking ahead, cross-border initiatives such as No Fear and Sea Safer are invaluable. They're also contributing to the strengthened energies among emergency medical care providers, expediting communication and decision-making during emergency situations and crises. Up to date, the cooperation with Israel, between the European Union and Israel in research and innovation field has already led to incredible breakthroughs in biotechnology, medical-related technologies, innovative cancer treatments, and the No Fear project is a testament to this successful collaboration. Also, under the new Research and Innovation Framework Program of the European Union, which is called Horizon Europe, Israel continues to be a very successful participant in health-related projects in areas such as immunotherapy, diabetes, and infectious diseases, especially in the cancer mission. Israel, moreover, is an active member of several partnerships under Horizon Europe, like the Partnership for the Assessment of Risk from Chemicals. At the same time, Israel aims to deepen collaboration with the European Union under the European Partnership for Pandemic Preparedness and the European Partnership for Rare Diseases and the European Partnership for Personalized Medicine. I'll add here a fact that maybe most of you know, but the successful cooperation between Israel and the European Union has allowed us to proceed together and more successfully tackle the challenges posed by the COVID-19. On the one hand, Israel agreed to provide the European Union with all the data which was so important at that time, collected from the application of the vaccines. On the other hand, all the vaccines that have been applied in the state of Israel have been supplied by the European Union. So this is really an example how we can cooperate in such situations where we have together to tackle global challenges. And research partnerships are really fundamental. They facilitate interdisciplinary and international cooperation between research teams, aligning our shared strategic priorities in health and security. It is of utmost importance that we continue to build on each other's expertise and technologies to find effective, innovative solutions in these areas. And we are looking forward to continuing our cooperation with Israeli researchers and innovators under Horizon Europe. We have, of course, to continue building together more resilient societies with improved emergency and crisis response systems. I would like, in closing, to wish Magen David Adom and its partners the best success in promoting the Saint Saver concept both locally and internationally. אני הבנתי שזה מטה חדש, הבניין חדש והכל חדש פה, ואני מאוד מרוצה לבקר אתכם פה. אני חושב שבקדנציות קודמות שלי אני הייתי במקום אחר, בתל אביב, ואני מאוד מתפלאתי מה שאתם הצלחתם לעשות פה. מזל טוב ובהצלחה. ועוד זמן קצר אנחנו נהיה בחגים, שנה טובה, מדוקה ומבורכת לכל אחד מכם, למשפחתכם, הרבה בריאות ושמחה. תודה.
Mr. Danny Secker, please.
It is always amazing to come to speak after Ambassador Sanchez speaking in Hebrew. I don't know to speak in Hungarian, Bulgarian, and things like that, but never mind. Every time it's a new good surprise. Dear EU Ambassador to the State of Israel, Dmitry Tsantsev, Magen David Adom, General Manager, Mr. Eli Bin, my colleagues from the Foreign Ministry, the colleagues from the EU Embassy, dear ambassadors, Magen David Adom, נוכחים יקרים. 2 days ago, we had in Tel Aviv, in the middle of our main city, a security incident. The incident involved immigrants, Israeli, police authorities, firefighters, Magen David Adom, health services, citizens, and caused many wounded. Large incidents that involve many people with different culture, different language, and many wounded need collaborative solutions to treat them safely and properly. No Fear as a collaborative project with international participants and many outcomes is one of the solutions to such events. On behalf of the Israel Innovation Authority, אני כאן כנציג רשות החדשנות, I would like to congratulate the project participant on the success termination of the project and wish that most of the outcomes of the project will reach to the field. So Secure Society projects, collaboration projects are important and have many values, especially in countries like Israel. Israel is paying a lot to be part of Horizon Europe program, and we need as many participants and many projects as we can, and I mean collaborative projects, in order to bring the money back to Israel for research and innovation. I want to wish you all a very pleasant day. Thank you very much.
Ambassador Ophir.
גבירותיי ורבותיי, ladies and gentlemen, Ambassador Tzanczev, friend, Mr. Eli Bin, the Director General of MDA of Magen David Adom, Danny Seker, Ambassador of Chile, diplomats, guests, dear friends. This kind of initiatives that we are witnessing here today and we are being exposed here today makes me feel very positive and very encouraged on a few levels. First level, of course, is Magen David Adom itself, which is Israel's official emergency services organization, a leading organization in the world in its own field, a very professional and a very innovative organization, and today's initiative is only one example for this innovative spirit of Magen David Adom. And for those of you who know Magen David Adom, you already know the other initiatives, technological and methodological initiatives, innovative initiatives Magen David Adom is leading. And for those of you who are still not familiar with those initiatives, I warmly recommend you to try and get some information on them. So as an Israeli citizen, I'm very much encouraged by this initiative. I think that this is one of the things that makes us feel safer, and we know that Magen David Adom is continuing to lead in Israel and to be a leading partner for other organizations also in the world. And this is very encouraging, and this is one level. The other level is to see this kind of cooperation, on the international level. And Chaim, a good friend here, mentioned the states that are involved in this, in the No Fear initiative. We feel that it's very important that we both contribute and learn from other partners in the world. And many other partners, many other actors in the world have a lot to contribute to us, and we believe that we, through Magen David Adom, have a lot to contribute to others. And this kind of cooperation is very important in that it makes the world safer. and it's very encouraging to see that. The other level is the Israeli-EU relations, which here we see, again, today we see another example of those developing relations, this time under Horizon Europe, which is an important goal and a very important framework of cooperation for all of us. All participants, all partners to this, to Horizon Europe have a lot to benefit, have a lot to contribute, and we believe, and it's very nice to see this, to see Magen David Adom taking its part as an innovative organization in Israel, taking part in this all-European program. Of course, the Innovation Authority has has a very important role to play in it, in this project as well as in others, and it's, again, it's very good to see all the dots being connected in this one project. So I would like to congratulate Magen David Adom and our European partners and our other partners around the world, and wish all partners to no fear a lot of success to the benefit of all of us, and looking forward to the rest of this day. Thank you very much.
Thank you very much. My Director General, please. Eli, before we start, number one.
תודה רבה, בוקר טוב. בון ויני, מסייה לאמבסדור. ברוך הבא, אדוני השגריר. תודה רבה על ההשתתפות שלך כמובן, להשתתפות פה של כולם. ואני באמת, כתבו לי הרבה דברים, אבל אני לא אוהב לקרוא מהכתב, אז אני אזכיר ברשותכם מספר מילים. קודם כל השותפים שלנו, השגרירים שנמצאים פה, האורחים הרבים, חבריי ועמיתיי להנהלת מגן דוד אדום, משרד הבריאות, נציגים של משרד הבריאות שנמצאים כאן. ואני בהחלט רוצה לומר מספר דברים. קודם כל, מגן דוד אדום, אדוני מר קריב, אתה צריך לדעת, זאת חברת הסטארט-אפ הטובה והמתקדמת ביותר במדינת ישראל, לא רק בתחומי ה-EMS, גם בתחומים החדשניים, ואני באמת מזמין אותך, וגם את הרשות לחדשנות לבוא ולראות מה עשינו רק בשנה האחרונה. אנחנו היום יודעים לתת תשובה ולצפות איפה יהיה המקרה הבא. יש פה אנשים שכבר עם הבינה המלאכותית כבר יודעים והכניסו אותה לתוך מגן דוד אדום. יש פה אנשים שכל היום חושבים איך מצילים חיים במדינת ישראל. והשיתוף הפעולה שלנו עם האיחוד האירופי הוא שיתוף פעולה שמציל חיים. בסופו של יום יש פה פרויקטור שהוקצה על ידי מגן דוד אדום, אבל מי שתומך בנו לאורך שנים זה האיחוד האירופי. הוא באמת משקיע במגן דוד אדום, גם במחקרים, גם ביכולת לפתח, להביא, לקדם נושאים שבאמת הם חשובים גם למדינת ישראל, ובסופו של יום הם מביאים גם תוצאה לאיחוד האירופי, כי יש פה תוצרים שאנחנו בונים אותם מתוך הניסיון הרב שאנחנו צוברים ארגון לאומי למעשה שנותן פה את המענה במדינת ישראל לכל אירוע חירום, בוודאי למצבי קיצון. ולא חסרים מצבי קיצון במדינת ישראל. בשברירית השנייה, ההתלקחות פה, אדוני השגריר, היא מטורפת. אתה ראית בלי שום התראה, בשבת בבוקר, פתאום צריך לטפל ב-170 פצועים, להביא אנשים מהבית, להביא אמבולנסים, לפקד על הכוחות, והכל בשקט. אתה יודע, את כולם הזכירו, את המשטרה ואת כוחות הביטחון וכולם עושים בלגן. מגן דוד אדום עשה את העבודה בשקט. צריך לזכור שלצד הדברים האלו צריך לספק גם דם לבתי החולים, מכיוון שהיו הרבה פצועים, וסיפקנו למעלה מ-200 מנות דם. זה דבר שהוא מאוד קשה, בעיקר בסופי שבוע. ותוך כדי פעולה, כמובן, אנחנו גם מבצעים התרמות דם בתוך בתי החולים, נכנסים לתוך בתי החולים, יחד בשיתוף פעולה עם מנכ"ל בית החולים באיכילוב, פרופסור גמזו, ומנכ"לית בית החולים בוולפסון, ואנחנו מביאים ומייצרים עוד כ-200 מנות דם ממש באותו יום, ומספקים אותם גם כן לצורכי הצלת חיים. הייחודיות של מגן דוד אדום, ואנחנו כולנו, אדוני השגריר, שומעים את הקולות. זו ייחודיות שהיא באה למעשה ממקום שאם תסתכל על שנות ה-90 של מגן דוד אדום ושנות ה-2000 של מגן דוד אדום, אתה תראה שינוי אדיר. אתה תראה את פלאי העולם שקרו בתוך מגן דוד אדום, ואפשר להגיד גם שצפינו פני עתיד. אם היום כל גוף בתוך מדינת ישראל אומר שיש מעורבות ממשלתית או פוליטית בתוך הגוף, במגן דוד אדום זה לא יכול לקרות. מכיוון שבמגן דוד אדום יש ערכים שונים, יש אידיאלים שונים, ויש דברים שלמעשה אנחנו מושתתים עליהם על פי עקרונות הצלב האדום. אין מעורבות ממשלתית, אין מינויים ממשלתיים, אין יכולת ממשלתית להגיד, לטפל בפצוע כזה או אחר, לתת קדימות למקום מסוים. כל ההחלטות האלו הן החלטות עצמאיות של הארגון, ואנחנו למעשה עובדים בשיתוף פעולה יוצא מן הכלל, כמובן גם עם משרד הבריאות וגם עם הגופים האחרים, אבל מאידך אנחנו כמובן מחויבים לעקרונות האלו של הצלב האדום, של שוויוניות, של מתן עזרה לכל אזרח, ולא משנה מה הוא ואיך הוא, מאיזה דת הוא ומאיזה גזע ומאיזה מין. הדברים האלו הם עקרוניים לכל איש מגן דוד אדום, וכל מי שלא מתיישר עם העמדה הזאת לא יכול להיות איש מגן דוד אדום. נכון, השמירה על הבטיחות היא דבר חשוב, היא דבר שאנחנו מקפידים עליו בתוך מגן דוד אדום, ואנחנו בהחלט עושים את הכל כדי לשמור על הצוותים שלנו. וכשאנחנו מסתכלים לאורך השנים, אנחנו רואים שההיפגעויות של אנשי מגן דוד אדום הן מזעריות ביותר, עד כדי 0 היפגעויות. מכיוון שהכללים אצלנו הם מאוד מאוד קפדניים, אנחנו מאוד נחושים ושומרים על אנשינו, אנחנו מאוד קנאים לבטיחות של אנשי מגן דוד אדום, אבל בעיקר אנחנו חושבים איך להציל חיים במדינת ישראל. שיתוף הפעולה הבינלאומי בין ארגוני החירום מאפשר למידה הדדית ושיפור יכולת מענה, ועל כך אני כמובן מברך. ובסוף מי שנהנה מכל הדברים האלו זה כמובן גם אזרחי מדינת ישראל וגם אזרחים שאנחנו למעשה מעבירים להם את האינפורמציה לגופים האחרים שאנחנו מעבירים אינפורמציה על מדינות אחרות ואזרחים של אותן מדינות. אני מברך אותך אדוני השגריר, אני מודה לך מאוד על היחס החם שאתה נותן למגן דוד אדום ועל הליווי, ובאמת לכל השגרירים שנמצאים כאן, גם השגריר האמירתי שהיה צריך להיות פה לצערי הרב לא הגיע, אבל נציגי משרד החוץ הנהדרים שמלווים את מגן דוד אדום בכל פעולה ובכל עניין, גם בנושא הצלב האדום ובעיקר ובדגש על הנושאים של האיחוד האירופי. אני מבקש להודות לכם, גם לשגריר צ'ילה שנמצא כאן, וכמובן לנציגי המשרד לביטחון פנים של מדינת ישראל ולמשרד הבריאות שמלווה את מגן דוד אדום ועושה את הכל באמת כדי לתת לארגון הזה מעמד לאומי וחדשני. תודה רבה.
You are hosted at Magen David Adom. So without some words about the organization, we will not let you go home. So I invite my colleague Uri.
Don't forget the refreshments, because the tradition of refreshments in Israel is something.
No, but we still have some program before the refreshment.
I'll briefly speak about Magen David Adom. Good afternoon, and thank you for joining us. And I'll start by telling you a story that happened not a long time ago. And I would like you to try to imagine the New Year's Eve at 6:20 p.m. somewhere in the Negev region, where a 6-year-old kid is riding in a pickup truck of his father, and an accident occurs, and 3 of this kid's fingers are badly hurt, almost completely amputated. Now, if you would speak about most of the EMS organization, ambulance services around the world, you would say, okay, this kid will be taken to the hospital and will have to live without 3 of his fingers in his arm, but not in Magen David Adom, because Magen David Adom is much more than an ambulance service. Using the technology that we have developed, as Director General Eli Bin mentioned, we sent pictures of those hardly injured fingers to the hospitals and asked which hospital can operate this kid now at New Year's Eve at 6:30 p.m. And when we figured out that it's Sheba Hospital that is located about an hour and a half from the location of the accident, we used our advanced means and flew this kid with a helicopter to the hospital, because in Magen David Adom we are not willing to give up for anybody's limbs or life. And to make a long story short, that's the end result. Using innovative thinking, using technology, using advanced means, we were able to allow this kid to go and continue his life in a normal manner. And Magen David Adom is, although that many Israelis perceive it as an ambulance service, is first of all a non-governmental organization. Although we are mandated by the Israeli government, we are not a non-governmental organization, and we do 3 things, and 3 things only. We protect life, we save life, and we give life in the state of Israel. We protect life by creating, by maintaining, and by operating a crucial infrastructure in the emergency medicine field. And we use technology in order to maintain this infrastructure, which is so crucial for other life. We save life by responding for each medical emergency that occurs in the state of Israel in a matter of minutes, regardless of where it happens, who is involved, and what is the emergency. And we give life, but first of all, by a vast network of volunteers and paid staff who give themselves for the sake of others. We give life by providing the liquid of life, the blood center that we are at, and we do all of this because at the end of the day we are here for the people. And preparedness is something that stands at the basis of the organization activities. The preparedness, the constant process, and the innovative thinking embedded in the organization, this is what allows us to send an ambulance each 30 seconds in the state of Israel. This is what allows us to respond for more than 1 million emergency dispatches per year. And this is what brings all the Israelis into Magen David Adom, and Magen David Adom into the consensus of the Israeli culture. And I mentioned technology. We spoke about innovation. We said this infrastructure that we have created will allow us to get the information in any means available from the field. If the population uses text messages, we'll use it. If they are using video, we'll use it in our system. If it uses it uses social media, we'll use it. And we'll take the information that we are getting from the public and find the most available resource that can help the patient in need, whether it's an ambulance, whether it's a motorcycle, whether it's a helicopter, or we hope that even an airplane. And this technology is based on artificial intelligence, knowing to identify the most available resource, and it's supported by machine learning. Director General Bin mentioned the prediction feature that we've introduced into the technology, saying I'm not leaving an ambulance team in its station telling him wait for the next call. No, we are actively going to the areas where the call are predicted Thus, and this is how we shorten the response time for the people of Israel. We took the chain of survival, the array of events that's supposed to happen from a minute somebody is undergoing cardiac arrest, and if we'll go step by step, hopefully the American Heart Association says we will be able to save this person, and we said going chain after, link after link is prolonged. Using innovative technology will make things happen in parallel. We don't want to wait for the ambulance to arrive. We'll send a first responder with a motorcycle. We'll send the ambulance to the scene while the call taker is getting the information and explaining how a lay person can perform a CPR. Everything in parallel. This is how you minimize inherent time gaps, and this is how you minimize the arrival time of a first responder in Israel for in less than 5 minutes. I mentioned that we save life by responding for each emergency, and our system knows to trace the most available resource. Some of those resources are our volunteers. One of our 32,000 volunteers who may be lawyers or businessmen or people sitting at their offices, and if, God forbid, something happens next to them, the system will automatically locate them. So we have stories of lawyers saying to their clients, listen, wait here, have coffee, eat something. You usually eat something in the state of Israel. I'll be back in half an hour because Magen David Adom is sending me on a life mission, to help somebody else. And we don't want to use radios. This is why we launch our teams using handheld devices, whether they are located in the ambulances or whether they are located with the people at their offices. And as I mentioned, we use anything that is there. Not only ambulances, but ATVs, a boat that exists in the Sea of Galilee, electrical bicycle in the neighborhoods, and even small vehicles that go to the predicted locations. And when we talk about the resilience of the society, so why don't we use the Israeli spirit of helping others and place publicly accessed defibrillators on lottery stands? And if something happens, you don't have to wait for somebody from Magen David Adom to arrive and start providing medical care. Magen David Adom dispatcher will tell you, listen, go to the yellow box which has sirens. I'll remotely open it and bring the defibrillator. So you can save people even before Magen David Adom is physically there, because we are there in the spirit of people. And when we spoke a lot about cooperation and knowledge sharing, and there is a big dispute in Israel regarding whether we should have a 911 system or not. And Magen David Adom, with our technology, we have created a virtual 911. The fire department operates a system that was built by Magen David Adom, based on the same system that I just spoke about. There is an automatic interface to the police. And nowadays, if somebody calls Magen David Adom and said, listen, I have a fire, and we have somebody who is injured, the fire department will get the notification automatically. Even more than this, the fire engine will be dispatched automatically. Think of this idea. Somebody calls, Magen David Adom paramedic responds. He speaks with him. After 2 minutes, the fire engine has already been dispatched. This is how collaboration, this is how knowledge sharing, and this is how technology and innovative thinking is embedded in Israel by Magen David Adom. And in the future, as Director General Bin mentioned, we are going to improve the system. We are going to use telemedicine in order to let people be treated at their home with a doctor providing instructions and guidance through video and through telemetry, without having them those people have to go to the hospital. And this is how we imagine the future of EMS. And with that, I'll just mention the volunteers of Magen David Adom. This is an actual picture of a Jerusalem team, where Fadi is a Muslim and Israel is an ultra-Orthodox person, and Chagai is a secular guy, and they all work together. And especially in the times of Israel, where what we do is usually argue. Before Rosh Hashanah, we have to argue. Having those three people in the ambulance is something that promotes hope in Israel. And having the ultra-Orthodox volunteer praise toward Jerusalem and the Muslim volunteer praise towards Mecca, this is how we demonstrate how cooperation and working together really creates a more resilient and more important and more inclusive environment, including the more than 10,000 young volunteers of Magen David Adom that serve in the organization. And as you know, we sit at the blood center. This is a factory for manufacturing the liquid of life. And I hope that you'll get more information while you tour. But this is how Magen David Adom encompasses the entire aspects of life by protecting life, by saving lives, and by giving life. And this was Magen David Adom in short.
Thank you, Uri. You've been sitting for too long, so I would invite you. We are honored to have with us staff and volunteers from Ayalon region. Effie is the director. He is here with us, and they will show you around the different vehicles that we have in Magen David Adom. You will meet now young people. More mature people. I've been told I should never say older. So more mature people, men, women, Jews, Muslims, secular, religious, ultra-religious, and as Uri said, at the end of the day, we are all here wearing this uniform with one mission, and it is to save life. And this is what brings us all together. And I will hand it over to them to show you around. So if you can please go out the door, the vehicles are waiting for you. Later we will go to the short tour of the blood services. Thank you. Sorry. First thing is a photo op. So we will lead you to the photo op. Inbal is leading you to the photo op. She will show you where, and we will continue from there.